My name is Nicole Odufalu. I'm a 4th semester nursing student. It is March 29th, and today I have an order to perform a Foley catheter, or administer a Foley catheter. So I would knock on my patient's door, provide hand hygiene, introduce myself. Good morning, Mrs. Jones. My name is Nicole. I'm your nursing student for today. Today we have an order to administer a Foley catheter. Can you please verify your name and date of birth? Awesome. While bringing you up, I'm going to provide privacy. Awesome. So now I'm going to don clean gloves. And I'm going to expose a little bit of your private area just to check for any distension on the bladder. Okay. So I'm going to check for any distension. Perfect, none. Now I will provide Peri Care. I would clean the outer labia, the inner labia, and the meatus from front to back. So now I will clean the outer labia from front to back. Throw that away. The inner labia. Now the meatus. From front to back. Okay, and now I'm going to cover my patient up, and I will expose from the bottom up just to keep you warm. Okay, I will take these gloves off and perform hand hygiene. And now I will open my kit. The standard is 14 to 16 French, but our lab kit came with 12 French, but I would use 14 to 16. And so I would open this kit, and I would make sure before I open it that it is intact. It has not expired yet, and there are no water drops on them, and that everything in here is everything I need. And this actual kit has 5 milliliter syringe, but I would use a 10 milliliter syringe. And then this kit also has stimulated swab sticks instead of betadine because we cannot use those on the mannequins. So I would use this as my trash bag. Now I would set this up down here. Then I would ask my patient, can you please raise your legs and have your feet flat on the bed? I open it wide so that I can have room for my runway. And then this would be for the date of the insertion and my initials. And now I would open my sterile kit. I would open the flap away from me first, then the two sides. I would have that 1-inch border around. And then now I will don my sterile gloves. Making sure to bend it back so that it doesn't flap back to avoid contamination. Then I have my 1-inch border. Then I would don the glove on my dominant hand first, holding the cuff. And then I will go under the cuff and don my non-dominant hand. Perfect. Okay, now I can set up. These are extra sterile gloves that I'll just throw away. And now I would set up my sterile field. I put the shiny part down, and I would cover my hands to avoid contamination. And I would ask my patient, can you please lift your bottom up so I can put this under you? Perfect. And I would put the drape down, shiny part down as well. Okay, and now I would carry this, pinching the insides to avoid breaking sterility, and bring it to the bed, connecting them so that I have a runway. Then I would take this off, put it here. Okay, and now I have to do everything sterile before I touch, because then I'll be contaminated. This would be for a clean catch urine sample. And now I will test the balloon. Okay, I'll throw that away. And this is the 5 milliliter syringe that I would usually be using a 10 milliliter. And I would put this here. And then push it in just to see if the balloon is intact and there's no ruptures. Inserting it slowly so that the balloon does not burst. And now I know that my balloon is intact. And then I will take the liquid out of the balloon now that I know it is intact. And I would leave it just like that. Then I would get my lubricant. And just have it open, ready to to lubricate 2 inches. So now I would get my swab sticks. I came in my sterile pack. I would get rid of this. Now I will clean the outer labia. Throw that away. The inner labia. And then the meatus. From front to back. Okay, now I'm going to put this in. I will pull this apart. 3, 2, 1. And I will push it in. If my patient complained of any pain, I would stop. I will push it in. Using my contaminated hand, I will hold the tubing and I will inflate the tube. Inflate the balloon. Slowly inflating. If my patient complains of any pain, I would stop. If I meet any resistance as well, I would push the tubing in a little more. Then I would take my contaminated non-dominant hand to hold to release. Then I would throw this away. And if I needed to, and then I would tape this to the inner thigh as close as possible so that they don't tug on the balloon. But first I would check if the balloon is fully intact and in there, gently pulling. Then I would tape it here to the inner thigh, and I would get the bag and put it on the bed frame and not on the side rails. And if I needed to get a clean specimen, I would grab the first urine that comes out first, and then I would label it when, and my initials. And then now the sterile part is over. So I would perform hand hygiene and put on clean gloves. So that now I can clean up my area. So I would rip this part, take it off, clean up my area, make sure everything is gone. But for the purposes of the video, I will be showing you how to take out the catheter. So I would have a clean 10 milliliter syringe, and I would deflate the balloon by taking out all the liquid. Okay, take that out, throw it away, and then I would slide this out. Ready? 3, 2, 1. Perfect. And then if there was any urine in this bag, I would take it out first so I could just throw the whole thing away. I would take this all out and throw this whole thing away. This would be in trash. And then if there was any excess betadine, putting it in or taking it out, I would perform Peri Care. So wiping the outer labia from the front to the back. And the inner labia from the front to the back. And now the meatus, front to back. And then I will take my gloves off, perform hand hygiene. I will return my patient back to a comfortable position. Okay, I'm gonna put your legs down and I'm going to cover you back up. This would also be in trash. And then I will cover you up. And here's your call light. And I'm gonna return you back to a low position. If you need anything, just go ahead and call us on your call light. You tolerated that well. My name is Nicole Odufalu. I'm a 4th semester nursing student. Today I'll be performing a Foley catheter on a male part this time. And so now I will knock on my patient's door, perform hand hygiene. Good morning, Mr. Jones. My name is Nicole. I'll be your nursing student for today. Today we have an order to administer a Foley catheter. So I'm gonna bring you up. Can you please tell me your name and date of birth? Awesome. And I'll provide privacy. Now I will don clean gloves so I can provide Peri Care and also check the bladder for any distension. So Mr. Jones, I'll be exposing your private area a little bit just to check to see if your bladder is distended, or also to check, also to provide Peri Care for you. Okay, in the area, perfect. Now I will be providing care for you. would start at the tip, work my way out, and down the shaft. Now, throw it away one more time. Out and down the shaft. Using a different part starting on, since I'm starting from one side going down, and the next side I would change the position of the wipe. Okay, and now I'm going to pull your covers up this way so that we can have enough space and make it open for your catheter. Make sure everything's nice and clean and sterile for you. Perfect. Can I lift your legs up? Will you be able to tolerate that and put your feet flat on the bed? Perfect. I'm gonna keep his legs as wide as he can tolerate so that I have enough room for my runway. Perfect. Now I will take these gloves off and I'll perform hand hygiene. And now I will open my kit. First, I will check to see that it is intact, that there are no water stains. I will check the expiration date and make sure it has everything I need. This kit has stimulated swab sticks instead of betadine because we cannot use those on the mannequins, but we would in real life. So now I would open this, bring it out, and I would use this bag as my trash bag. I would open the furthest part away first, and left and right, avoiding it flapping back to avoid contamination. And then I will put on my sterile gloves, pushing it back to avoid it flapping back for contamination. And I have my 1-inch border. Now I will first don my dominant hand, pinching the cuff, putting my hand in. Now I will go under the cuff to don the sterile glove on my non-dominant hand. I'll put my hand in the glove and bring it down. Awesome. So now I will set up my field. First, this is extra sterile gloves and I don't need. And now I will put the shiny part down. And I would ask my patient, can you please lift your bottom so that I can put this under you? And I would tuck it under my patient. Perfect. And then I would grab this portion to put on the private area. The shiny side would also be down. Avoiding touching anything. Perfect. And now I will grab my sterile kit from the inside, folding and attaching, making sure that I have a flow. Now I will take the top off, and I'm performing everything sterile first. This tube I would use for a clean couch specimen that I will take out of the bag. The first urine specimen that comes out, I would name, date, time, room number, everything, and I would put it on here. And now I'm going to check to see if the balloon is intact and will inflate. So now I will attach this 10 milliliter syringe to make sure that the balloon will inflate and is intact and won't rupture. So now I will push in slowly to avoid rupturing the balloon. Now I see that balloon is intact, it's not ruptured. And then I will pull the 10 milliliters back out. I would leave this connected, putting it back in here. Okay, and now I will get the jelly and I will open it and pour some here to lubricate the tubing. I will lubricate the tube. Okay, and I would leave it just like that. And I will take my swab sticks to perform care, which these would be the betadine swab sticks. I will just throw that away. Okay, now I will clean the meatus, starting from the meatus going out. And if there was foreskin, I would bring the foreskin down before I start to clean, and I would return it after. So pulling the foreskin down, start from the meatus going out onto the shaft, and one more time from the meatus out onto the shaft, and then I would return the foreskin back to place. Now I will be putting in the catheter. All right, Mr. Jones, I'm gonna be putting in the catheter. Please take a deep breath on the count of 3. Ready? 1, 2, 3. And I'd put this in as much as possible, and if he was feeling any pain, I would stop. Putting it in. Then I would hold here so that I could take my sterile hand, because this is non-sterile, and I would push slowly all 10 milliliters to inflate the balloon. If he was feeling any pain, I would stop and push it in a few more inches, an inch. Now I will take the non-sterile, non-dominant hand and hold here to remove the syringe, and I'll put the syringe in the trash. And then I would tape this to the inner thigh, making sure there's a little leeway so it's not pulling. But before that, I would pull to see if the balloon is inflated, and then I would tape it here. And then I would put the urine bag onto the bed frame and not onto the side rails while this is taped. And now I will take off my gloves, and if I had to get a clean catch specimen, I would do that. And I would take the first urine that comes out, and now that it is in, I would clean up my area, but for the purposes of this video, I will be taking out the catheter. So I would perform hand hygiene. And I will don clean gloves. And I would have this as a clean syringe that was pre-packaged, and it will be 10 milliliters. So I would attach it to deflate the balloon. Okay, ready, Mr. Jones? 3, 2, 1. I will be pulling it out. Perfect. And if there was any urine in the bag, I would empty that out first so that I could just throw this away. And I would clean my area, and I would also clean from using wipes from the meatus to the shaft if there was any extra betadine. And take my clean gloves off after cleaning all this area. I would remove everything Throw everything away in the trash. All trash. And now I will return my patient back to a comfortable position. All right, Mr. Jones, you did great. So I'm going to cover you right back up. And then I will put my patient back into low position, and I'll have your call light. If you needed anything, you could just press your call light. I would document how the patient tolerated it, whether it be insertion or I would be taking it out. And then I would also document if there was any urine, the intake or the output, and that would be it.